Good day everyone, I'm Alexis A. Lobaton from BSN 1A. For today's procedure, I will be doing the Tepid sponge bath. It is the application of cold water to the surface of the skin by means of a wet sponge. Assessment. Assess the client for the other signs of fever, skin warmth, flashing complaints of heat or chilling, diaphoresis, irritability, restlessness, general malaise or delirium. Determine patient's ability to tolerate cold sponge bath. Third, assess baseline vital signs and any hazards to the patient's vital function with the application of cold. Then observe fluid and electrolyte status, especially in patients with elevated temperature. Lastly, assess condition of skin before and after application to determine if application occur. Objectives. First is to reduce body temperature by conduction and evaporation. Second, to relieve restlessness, thereby providing comfort and relaxation. Equipments. Water source of coolant may be tap or cold. Basin for sponge bath. 2 washcloth. Bath towel. Large sheet to be utilized as bath blanket and table protector. Prepare the water to a temperature of about 29.5 degrees Celsius or 85 degrees Fahrenheit. Prepare the client to gain cooperation. Explain that the face, neck, arms, leg, and back will be sponged and that the procedure takes about 25 to 30 minutes. Protect the patient's bed with moisture-proof material. Remove the gown and assist the client to a comfortable supine position. Cover the patient properly to prevent shivering as various parts of the body are exposed to bathing. Removing the gown provides access to all skin surfaces. It is for prevention of chilling, minimal exposure, and provision of privacy. Wet 4 washcloths and fold into 4 parts. Wring them out so that they are very damp but not dripping. Washcloths need to be as moist as possible to be effective. Place washcloths in the axillae and groins. Leave washcloths in place for about 5 minutes or until they fill. Place washcloths in the axillae and groins. Leave washcloths in place for about 5 minutes or until they feel warm. Re-wet and replace them as required during the bath. Washcloths warm up relatively quickly in such vascular area. Sponge the client's face with plain water. Pat to dry, then sponge the neck. Sponging of the face and neck should be within 3 to 5 minutes. Friction of rubbing may raise body temperature. Sponge the arms and legs. Place a bath towel under one arm and sponge the arm slowly and gently for about 3 to 5 minutes or as tolerated by the client. Slow, gentle motion are indicated because firm rubbing motion increases tissue metabolism and heat production. Cover but do not dry each part as it is sponged. Evaporation of moisture on the skin helps to reduce body temperature, and excessively heavy covering may increase body temperature. Do the same thing in the lower extremities. Hold the washcloth briefly over the wrist and ankles. The blood circulation is close to the skin surface in the wrist and ankles. Check the patient's skin color and pulse rate during the bath. This indicates that the temperature of the patient may have dropped to subnormal level. Do aftercare of equipment and change bed linens if soiled to avoid transmission of infection. Check the patient's body temperature about 30 minutes after the bath to evaluate the effectiveness of the sponge bath. Document assessment including the temperature rechecks. Recording communicates the care provided in an accurate and firmly fashion. Lastly, perform hand hygiene to deter the spread of microorganisms.